Alhamdulillah, wassalatu wassalam ala Rasulillah. Assalamu alaikum wa rahmatullahi wa barakatuh. Warm welcome to everyone to this new exciting course called Save One, Save Humanity, presented by Arukak. We as a group of emergency doctors, emergency medicine doctors, myself being Dr. Nabil Abdul Rahim, Dr. Zishan Ghani, Dr. Noordin, and Dr. Vikas. We are emergency medicine doctors who have come forward to present this course, which is pretty crucial, I think, at this stage for ourselves and our ummah in general. Moving on to what was the reason that we chose this course. The basic purpose was to be known as life savers. The ayah of the Quran from Surah Al-Ma'idah, وَمَنْ أَحْيَاهَا فَكَأَنَّمَا أَحْيَا النَّاسَ جَمِيعًا. And whoever saves one life, it is as if he had saved the entire mankind. And this was our motivation. This was what motivated us actually to start this course and teach people this art of saving lives. And it is a great reward indeed that you could, if you are able to save one life, it is as though you've saved the whole of humanity. And also in our times, of Islamophobia all around us and, rampant misnomer being spread about us, this is a perfect refutation. Those who say that, there are individuals who are doing more harm to humanity. In fact, the same ayah says that whoever kills a soul unjustly has killed the whole of humanity or slain the mankind entirely. So I really hope that this course makes us and shows us as lifesavers to the world. So this course, Save One, Save Humanity, it comprises of 3 parts. The first one being basic life support, which will consist of 3 classes. Second one being basic trauma life support, that will again be of 3 classes. The third one being environmental emergencies and poisoning. So basic life support. The name has the term basic. The 2 main elements for life, the 2 main parts of our body that actually require life to sustain is breathing and blood circulation. Anything that obstructs breathing or blood circulation, and if you're able to do anything to make that person, feel better, that would save his life, then that is called basic life support. So it comprises of first one being a CPR. If someone's heart stops beating, your hands need to be the support for the heart to pump the blood out. So you start compressing on the chest, press the heart so that it pumps the blood to the brain and other parts of the body. Similarly, on the left side, you see there's a photo of a man choking. If someone's breathing pipe or the windpipe is obstructed with a food particle or a meat or something that is obstructing him from breathing, what is it that it can do to relieve him of that obstruction, to make him breathe better? So that's called choking pathway, and we will teach that, how exactly to do that. Also, we sometimes see that there are children and even babies who suddenly stop breathing or turn blue, or they don't have any pulse. What would you do at that time? And what you could do to make their heart beat again or them to start breathing again? And also we have many other elderly family members who sometimes just collapse to the floor, who lose consciousness. what would we do that time to make them feel better? And how would you give a support to them at that very situation when they need it most? Also, we have topics like anaphylaxis. The name sounds a bit complex, but it's just a severe allergy. Sometimes someone takes something, a medicine or a nut, or it could be a fish, or it could be a crab, and suddenly they start swelling up so much, and they have an allergy reaction that can obstruct their airway. It makes them difficult to breathe. And there is a life-saving drug for that. So these are things, this is just the gist of it. These are things which we want to actually talk about, tell all of you that what is it that you as a person at that moment can do to save that person's life, even before the ambulance or even before the person goes to the hospital. The second part of the course we will be covering would be basic trauma life support. Trauma is one of the major deadly conditions of our time because of various road accidents, car accidents, bike accidents, drowning, and various other things. We will talk about what you could do when you witness a car accident, where someone is bleeding. How would you stop the bleeding from that person? And what you could do to make sure that he reaches hospital safe, or what you could do to keep that person alive and safe till the ambulance arrives. Also, we'll be talking about burns. If some part of your body, some part of a person's body has had a burn, a chemical burn, or a fire burn, what is the right thing to do, and what are the wrong things which you shouldn't be doing? And we will talk about fractures. At some moments, it might look very gross to you that someone's fractured a part of a limb, but there are things, that is the exact moment that you need to act up to do something that could save that person's limb. And we will briefly touch on also drowning and what you can do to help someone who has just been saved from drowning and how to resuscitate him. The last part of the whole course would be environmental emergencies and poisoning. It's a very broad topic, but all we want to do is to give you some general principles on a day-to-day basis, what you can do to probably save a person. Let's say someone who has been electrocuted, has got a shock from a socket, okay, or he was working on an electrical equipment, he's got a shock, electric shock, and he's fallen. What is it that you should do and what you shouldn't do? If someone has been bitten by a snake or a scorpion, or stung by a scorpion, what is it that you can do? Also, with the rising temperatures, we see a lot of heat stroke. People collapse because of the enormous amount of heat in the environment. What are the simple things that you can actually do that makes a big difference to them, even before they get to the hospital? And in cold areas, there is an issue of frostbite. We will talk about that a little bit. And there are various poisoning. Either someone self-harms themselves, or you see by accident, someone is harmed by a poisoning, a plant poisoning, chemical poisoning, various different poisons. And there are principles that we would share with you which will help that person be safe at that moment. This is the schedule of the whole course, which inshallah I will be sharing. This will be shared in the Google Classroom. You'll have an idea of what is going to happen in the next few weeks. Before I actually go into the main course today, I would like to put forward a disclaimer. This course is not a certificate program for basic life support. What we are trying to do here is to encourage you to initiate the basic life support process. There will be no general attendance. There will be a general attendance certificate, but you will not get a specific certificate that you have completed basic life support, because there are centers in your own individual areas which will provide a basic life support certificate when you attend the course in person, and they certify you based on that. Also, we do not endorse or promote any individual or organization that you may come across in this presentation. But remember that you do not need a certificate to do CPR. You do not need a certificate to save someone's life. Everybody, every single person is allowed to do whatever he can at that moment to his best of his ability to save someone's life, a CPR or any other life-saving intervention. You do not need a certificate. Let's start today's session. So the question I want to put forward to all of you is, what would you do when you see someone collapse? What was your first response? Before we actually answer that, I want you all to see a video. This was one of the videos which became a bit viral in Facebook recently. I presume this is from one of the places in the Indian subcontinent. You see a man who is praying, who's starting the Salah in Jama. Just as he is doing his Salah, he might have experienced a chest pain or a heart attack. We're not entirely sure. I would let you watch the video just so that you get the idea of what is exactly happening. Here we see that the man collapses suddenly to the floor. There are two people who are helping him out and moving him towards the wall. You see in the video that there are three people standing around him. They genuinely do want to help him, but we just see that they're moving about here and there. And it's been a couple of minutes now, almost 3 minutes, and we see that no one has done anything at the moment till now. They haven't even checked the pulse properly. Then the Salah finishes, and we see a lot of people approaching him. Again, the crowd stands around. There are a lot of people who are standing around who really do want to help him, but are not really aware of what exactly to do at that moment. In between, I also see a man who is trying to rub his arm, his palm, and trying to make him warm in his palm to see if that could help him. So someone has alerted the ambulance, or I suppose an emergency number by now. You see there is a lot of crowd around him, but there isn't anyone at this moment trying to do anything to him. But just stand around and they're all looking at him. So in a while, two people come. I'm not sure if they are from the ambulance team. They have taken him on a stretcher. And sadly, they too, I'm not really sure, are assessing his pulse or not. But he's been transported on a stretcher. And he's just been carried. So my question was, what was done to save his life? Well, also for information to all of you that this brother lost his life. He passed away. Inna lillahi wa inna ilayhi rajiun. We do feel sad for this, but my question was that could something have been done to save his life? Now, in contrast to this, I want to show you another video. This incident takes place in United Kingdom. There is a gentleman who is practicing martial arts. As you can see, this is a real video, and he collapses suddenly to the floor. So one of his friends, he approaches him. He suddenly realizes that he has collapsed. He's probably not breathing. He does not have a pulse, most likely after he checks him. He starts chest compressions on him right away. And as you can see, by the same time, someone has already called the ambulance team. The ambulance are over the phone telling them to continue the CPR. You know, this is not, whatever breathing or whatever he's experiencing now is not normal. He needs to have chest compressions. And you can see that his friend is giving chest compressions to him till the ambulance crew arrive. So they bring a defibrillator, they attach it to the chest, and they give a shock to him, and they continue chest compressions. So thanks for the CPR and the use of defibrillator, that man was saved. He got his pulse back. He was transported to the hospital safely. And he makes a good full recovery. He's discharged from the hospital as well after that. Sorry for this lag, just hold on. So, starting with BLS, basic life support. Part one of this whole episode is going to be CPR. You would have heard this term CPR many times, I'm sure, multiple places. But what does actually CPR mean? The full form of CPR is cardiopulmonary resuscitation. Cardio is heart, okay? Pulmonary means lungs, and resuscitation is the act, what you're doing. You're pressing the heart from outside, and you're making sure the blood goes to the lungs and the brain. So why is it that we need to learn CPR? What is it so important to learn CPR about? Is there an evidence? Is there a logical evidence or proven scientific evidence that everybody should learn CPR? Yes, there is. There are many, many studies throughout many decades that's been done. But this one study, which I've showed it to you on the screen, is from February 2020, this year. They have collected all the studies from all across the world, and they have seen how many people have died or reported deaths, okay, from people who have collapsed and had heart attacks outside hospital, at homes, at streets, in malls, and how many people came to rescue them. How many people were there who did the CPR. After all their analysis, after all their study and research into it, their conclusion was that the survival of a patient, of a person who collapses, was much higher when a person who was standing next to them gave CPR. The first 10 minutes, no one is doing anything. And then you have a very good ambulance system coming in, and you take him to the best hospital possible after that. It does not make much of a difference at all. It doesn't matter to the best hospital you take after 10 minutes when you have not done anything for the first 10 minutes. So the first 10 minutes is the most crucial period when someone's heart stops. So that is the reason that we want all of you to learn CPR. It might look very complicated, but all we want you to remember out of today's session is this mnemonic, which I'm showing on the screen now. Doctors ABCD. All you need to remember is this. If there's one thing that you can actually grasp today, we will be happy that you have learned and you've got what you're supposed to get out of this class. Doctors ABCD stands for D is for danger. First thing is to look for danger. R is checking for response of the patient. S is send or shout someone and tell that get help, call for ambulance. ABC is airway, breathing, and circulation with CPR. So you're assisting the person to breathe properly, and you're doing CPR at that moment after you check for pulse. If the patient has no pulse, you start compressing his chest right away. The last part is D, defibrillation. You give the person shock through the machine when it's available. So I would stop at this point. What I will do now is ask my colleague, Dr. Zishan, to take over, and he will explain to you what each of these actually mean. And he will explain in a bit more detail of what each of these components mean and what is it that you can do.
Hello, assalamu alaikum, Nabil.
Wa alaikum assalam.
Right, so I'm clear, is it?
Yeah, alhamdulillah, you're clear. You can continue now. Yeah.
All right, fine. Okay. Jazakallah khair. Bismillahirrahmanirrahim. Very good introduction by Nabil. Okay, so let's continue from where he has stopped. Can you see the slides, Nabil? Is it okay?
Yes, it's clear. Yeah.
All right. So I think Nabil has given a very good introduction and he's told us what's going on. Sorry. Yeah. Oops. Okay. So yeah, we've talked about DRS ABCD. Now the first thing people need to remember is I was looking at a lot of the chat messages. People were saying what needs to be done. Are people overcrowding it? How do we save lives? In that video, actually, people haven't really done anything. They've just been standing next to him and looking at him. Unfortunately, although they wanted to help, but they could not help. Now, whenever you approach a scene like this, when somebody has collapsed, always remember this format, the DRS ABCD. Try to remember this. You start, if you want to help someone in the middle of, a road accident or somewhere in a public place, look for signs of danger. Now this picture here, it's an interesting picture. What you see here is, I'm sorry for the markings, I was trying to use a pointer. What you see here is, look at this car accident. There are a lot of danger signs here. You can see electric wires hanging. You can see fuel from the car. You can see people fallen down. There is chemical over here as well. So these are all the things that you need to look for. Now, if there is someone lying near an electric wire, take them out of the electric wire. If there is someone lying next to a burning area, move them out from there. Someone had drowned in water, take them out of the water area first. Don't go into the water area and try to help them. No, it's not safe. You can't help much in that area. You need to come out and then be able to help them. Okay. So yes, always start with scene safety. Make sure everything is safe around you. The next thing, go and try and wake up the person. So this is for someone who's become unconscious. If there is someone conscious, yes, I think someone had given an answer that put them on their side. That's good. If they're conscious and breathing and if they look okay, fine. But if they're not conscious and if you're very worried about them, go and wake them up. Go and squeeze them, squeeze their shoulders. Ask them, are you okay? Try and wake them up. See if they're getting up from there and see if they're answering at all. If they don't answer, then yes, you should be worried. Okay. Hello, sir. Can you hear me? Hello, ma'am. Can you hear me? Open your eyes. What is your name? Now, let's say they're not saying anything at all. Now, what do you do next? So the first thing you need to do is you've seen if there is danger, you've checked if there's no response. Then the next thing you need to do is call for help. Now, this is very, very important. You need to call for help. Okay. If you don't call for help, and if there's, now you look at that group in the video, there were 10 people there, all 10 of them just stood. How many of them actually called for help? Not many actually. So it's always best that you point at someone. If it's your friend, if it's your relative, tell them, please call the ambulance. It might be 108 or any number that you know in your country. Okay. If it's in a public place like a railway station or airport, tell them, please call the ambulance. Please get the AED. AED is an automated external defibrillator. You can see this on the photo. That machine gives you shock. What you see people do in the hospital. This is a small machine that gives a shock. Okay. Now, once you've called for help, you continue with your assessment of the patient. You look for danger. You look for response, no response. You told your friend, please call the ambulance right now. If there's no one, if you're the only one, let's say you're alone in the house, something happened like this, you call the ambulance. You can put it on loudspeaker and talk to them while you're seeing the patient, the person. The next thing is, so we have finished D, R, S. The next thing is A, B, and C. Start with airway. The biggest thing in your mouth is your tongue. Okay. Now, if a person gets unconscious, the tongue, it looks small to people from outside, but it's quite big. It's a very big muscle inside the mouth. That muscle tends to fall back. And you see what happens here. The moment it has fall back, this is the passage for the air that has got blocked. Now, no air can't reach there. So he can't breathe. That's why what we do is open the mouth, slowly tilt the head, not too much, slowly, and see if you can lift the chin up. We'll show this in the live demonstration. When you do this, you will be seeing the head tilting and chin lifting. Okay. That's when you'll see a little bit of space coming up in the mouth. Then you'll see if they're breathing well or not. After that, you check the circulation. Okay. The circulation can be checked by looking at the carotid pulse. Now, that's a very big pulse that we have here near our neck. That's where you have the carotid artery. If I can show you that photo, let me see. We have an image of that. Can you guys see this photo, everyone? Nabeel? Hello?
Yeah, you can see.
Yeah. So look, so this is the pulse that we're looking for. This is your carotid pulse. That's a very, very big pulse, artery that's very close to your heart. That's where you're putting the hand and you're feeling for a pulse to see if the person has a heartbeat or not. Now you'll see people holding the hand, checking for pulse. No, we don't look for that. we need to look for this pulse that's here. Okay, now coming back to the slide. So that pulse can be felt right below the jaw. If a lot of you are sitting there, try and feel your pulse. You will feel a small bounding and rebounding sensation with your two fingers. That's where you feel for the pulse. And you need to practice this. You need to be able to know where it is. Because in real life, when you panic, you may not know what you're feeling. But it's okay. If you don't see something, go for the next step. Anyways, let's say you look into the airway A, you cleared it, there's no foreign body, there's no food particles. Sometimes people while eating, they collapse. There might be some food particle in the mouth. Take it out. You check for pulse. Let's say the pulse is not there. And the maximum you need to check the pulse is for 10 seconds. Don't try and look for 30 seconds, 1 minute. No. The heart needs to pump blood, the brain needs blood. It can't be without blood and oxygen for so long. 10 seconds, you don't feel anything, go for the next step, okay? So that was A for airway, B for breathing. You come close to the face and see if they're breathing. If you can feel the chest is rising, if you can feel air coming out or not. C, this C over here is circulation, okay? Now this circulation is where you look for the pulse. The next step is, if none of these are there, if the airway is fine, the breathing, there's no breathing, but there's no pulse, and now you know that the person's heart has stopped beating. This is when you need to start helping people, okay? This is called CPR, cardiopulmonary resuscitation. Unfortunately, 50 years back, people didn't really have idea about this. So people really didn't really know how to save lives. But with a lot of research, people have found out that by doing this, this actually helps people, okay? You take both your hands, you make them, keep them in the position like how that man has kept there, and you go in the middle of your chest where your chest bone in the center ends. Not on your stomach, be careful. If you're pushing it on the stomach, you're not really helping. The person might vomit, okay? But you need to put it at the lower end of the bone of the chest. It's called a sternum in medical language. Once you put your hand there, start pushing it hard and fast, okay? Now you need to be able to count. So normally what we do is we count it, 1 and 2 and 3 and 4 and 5 and 6. So you go for 30 compressions. See here, 30 compressions and give 2 breaths in the mouth. Now, if it's your relative, yes, you can give them a breath after giving 30 compressions. You give them 2 breaths in the mouth. Okay. But if it's not your relative, if you think that someone who has an infection like COVID or coronavirus, or if it's in the public, you don't know who that person is, it's a stranger who might be having any illness. So don't give 2 breaths. You just start giving 100 compressions. Okay. Count continuously 1 and 2 and 3 and 4 and 5. Go till 100 or 120 per minute. You don't need to stop. An important thing is how deep you go. You see this 2 inches, roughly it's the size of your forefinger or your middle finger. That's how deep you need to be able to go when you push. I've seen someone sadly in real life try to do it and they didn't know where to press. They were just pressing somewhere. But yeah, so you need to be able to give a proper deep compression. And in hospitals, sometimes even the ribs crack because that's how hard we are pushing it in. Okay. This is to show you how important it is to be pushing hard and fast. If you just do a gentle rub on the top, you're not doing anything. He is pressing that hard so that the heart gets compressed. Only when the heart gets compressed, the heart will pump blood. Okay. Now, while you're doing this, you should have called someone for help and got an AED. Now, this is an AED here. Okay. The AED is called an automated external defibrillator. It basically gives you an electric shock. Okay. it has two pads. You might have seen on medical shows, they take two pads and they put, what it does is your heart is in the center here. This thing gives you shock between both those areas. So when the shock goes between both these areas, it tries to restart the heart. That's your normal heartbeat. And if your heart stops pumping normally, it will become abnormal like this. This is when you need to give it a shock. If you give it a shock, then you have chances that it might come back. Okay. Yeah. Moving on. So this is a video that we got. Yeah. So now look at this video. So now what happens is, this video is about how doing a CPR helps people. Okay. Now if you're in a general public area, what do you do? There's no ambulance, nothing. So you need to start with this DRS ABC. Okay. Now, again, first is danger. Look around. Is there any dangerous object near him? Chemicals or fire burning, anything at all? No. Okay. Then you go to the person, check for response. Hello, sir. Are you okay? Can you listen to me? What's your name, sir? Are they responding? No. Call for help. Please help me. I need help. Call the ambulance. Call the AED. This person has collapsed. Tilt the head slowly. Put the pressure on chin. Look into the mouth. See if they're breathing. If there's any foreign body, take it out. Come close to the mouth. See if there's any air coming out or not. Look at their chest. See if the chest is rising up or not. Okay. Once you have done this, you'll be able to hear some amount of air coming out. If there's nothing coming out, you've done this for maximum 10 seconds. The next thing is you go for C. Okay. You check for pulse also. There's no pulse. Obviously, ambulance should be on the way by now. Okay. Now this is the C that you're checking for. If the blood is flowing properly through the heart or not, you can look at it by feeling the pulse. Okay. If that is also absent, then you go for chest compression. See the way the person is holding the hands. Don't put both your hands open. Keep them one close on top of the other. Start pushing them hard and fast. Okay. Count them 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9. Keep going on 30 or go for 100. Okay. If you think you're not able to remember 30s to 2, just go for 100 continuously. The rescue breath is only done if you know the person. After 30, give them 2 minutes, 2 breaths. If you don't know them, just continue giving them 100 continuously. And if you have a person with you, it's very good if they can come and swap. Okay. As soon as you reach 30, tell them, come, you take over, I'm tired. Because a tired person cannot help. Once the defibrillator arrives, the machine that gives you shock, you have to open it up. But this is a very simple device. People might think it's very complicated. No, everything is automatic in this. The moment you connect the pads, one on the right side, one on the left side. Remember, you have to put it that way. On the right side and on the left side. Right side and left side, not side by side. Switch it on and that will start detecting for the heartbeat and the irregular pulse. And it will tell you by itself when to give a shock. You give the shock. Okay. In conclusion, remember, I'll just go through it again. D, danger, check for response, shout for help. Of course, you have to call for help, check the airway, check the breathing, circulation, and the defibrillator. Okay. Now, yeah, that's what. Now, what we'll do is we will be giving you a live demonstration by our friend Dr. Vikas, who's in Kerala right now. And yes, Jazakallah khair. And thanks, Nabil, for the PowerPoint presentation as well. We will be answering the questions at the end. Yes, Assalamu alaikum.
Salam. Jazakallah khair. Dr. Zishan, he's done an excellent demonstration there of what needs to be done theoretically. But now we're going to do a live demo by one of our brother and emergency doctor who is currently working in Kerala, India. So, Vikas, could you turn on your video if you can? Just wait for Dr. Vikas to switch his video on. Few technical glitches at the moment. We will get his video on soon. Dr. Vikas is, kindly agreed to demonstrate this whole process in his hospital where he's working along with his friend. There's another doctor who's with him, Dr. Nabil. They both are going to be showing us a live demo of what we should be actually doing when a person collapses. I know a lot of you have asked questions, and we are collecting all your questions one by one slowly. Keep your questions coming in the chat box. Make it concise, make it very clear. Do not repeat the questions. You can ask questions in the chat box. And we have Dr. Noordin, who is collecting all your questions one by one, and we will answer them, inshallah, as much as we can towards the end.
Nabil, I think you have to enable Vikas, brother.
Okay. He is on the spotlight. Yeah.
Yeah, he has come here. Assalamu alaikum, Vikas.
Wa alaikum assalam wa rahmatullahi. Thank you.
So,
Thank you.
Thanks a lot for participating with us today. So what we are going to do now is a demonstration of what you should be doing when a person collapses. So I'll be just talking through the scenario, and Dr. Vikas Ahmed on the other end will be demonstrating to us what we should be doing. So first thing is, you're away and you suddenly see a person collapse. So the first thing is D, danger. So you've got to look for dangers around you. Is there any fire, electricity, any water, chemical that could be actually harming yourself first? So you need to make sure you are not.
I don't see any danger.
Okay, great. So next you approach the R. R is response. Check for response.
Hello, sir. Are you okay? Can you tell your name? Hello, sir. Are you
You can
okay?
ask for the name. You can ask them to open their eyes.
Hello, sir.
Okay.
There's no response.
There is no response. So the next stage would be S, shout for help. So look around.
Can you help
if you
me,
see anyone.
Nabil? Can you help me, Nabil? Can you call the ambulance?
Okay. So that is a good thing. If you notice how Dr. Vikas is doing, he's calling someone by name and telling them, can you call the ambulance? If you say, can someone call the ambulance? Maybe no one might do it. So you need to very clear say, can you call the ambulance? And get an AED if possible. Next stage. Yeah. Next stage would be S and the DRS, and then you start A, airway assessment. So you head tilt, chin lift. Left hand on the forehead and the right hand on the chin. He is tilting the head and lifting the chin. What that does is, as Zishan explained, it opens the airway. Now the air can freely breathe from the outside to the lungs. You open the passage. Okay. If you don't see any chest movements, as Dr. Vikas is showing, if you don't see any obvious chest movements, if you don't feel for any breath, at the same time, when you're doing this, keep your 2 fingers on the side of the neck, just on the side of the neck. So not the center, the side. Okay. And press it a little bit deep, and you can feel a pulse, and that's the carotid pulse. If you
I'm checking for pulse. There's no pulse, I feel.
Okay, and this process is done for 10 seconds, not more than 10 seconds. You should not do this more than 10 seconds. The moment you don't feel the pulse for 10 seconds, you start CPR immediately. So center of the chest, he's marking.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
He's given 30 compressions. Now what he's going to tilt the chest again, pinch the nose, and he can give 2 breaths. And then you go back to chest compression immediately. Again, go back
1,
and
2,
start doing
3,
30.
4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 20, 20, 30.
Perfect. He again gives 2 breaths. And continues chest compressions.
2, 3, 4, 5, 6, 7, 8.
As you can see,
10,
this is a very
11,
tiring
12,
process.
13,
It's
14,
not easy,
15,
but
16,
at that moment,
18,
if you are the
19,
only person
20,
doing this,
20, 20,
we would
20,
recommend
20,
that you
20,
continue chest
20,
compressions
20, 20.
continuously. 2 breaths. Okay. So because I would like to stop now for a moment.
Yeah.
So this process of 30 compressions, 2 breaths, 30 compressions, 2 breaths. This goes on until you get the AED machine. Let's say if the person whom you asked to get the machine, if he goes to the nearby mall or the airport he is in and he gets the AED machine and he's come, you stop your CPR immediately and attach the AED machine to the person's chest. Like how Dr. Zishan mentioned, they have 2 pads. You attach one to the right, one to the left. The machine will tell you how and where to attach the pads, and you turn on the machine and let the machine speak. The machine will tell you clear instructions. What the machine is doing at the moment now is it's analyzing the heart rhythm. It's like taking an ECG, and it is checking what rhythm the heart is currently in. If it is in a rhythm that is fibrillating and the heart needs shock, the machine will tell shock needed. So when it says shock needed, kindly move away from the patient. Don't touch the patient. And Dr. Vikas, like he will notice if somebody else is around, the patient will tell him, please step away. And when everything is, when it's safe, he will press the button and the machine will deliver shock. Okay, the patient gets a shock. As soon as he gets the shock, continue the chest compressions suddenly again.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 20, 22, 24, 25, 26, 27, 28, 29, 30.
Thank you. So thank you very much, Vikas, for the demonstration. And so this is what we're asking all of you to do, that continue chest compressions and 2 breaths, chest compressions and 2 breaths. And if the AED is there, it will tell you when the shock is needed. In most places, if people are not able to get the AED, you have to continue giving the chest compression and 2 breaths till the ambulance arrives. The ambulance will have an AED with them, will have the machine which can give the shock. So the question would be that how long can one person do this? It is very difficult, I understand. And if you have another person, you should change with them after 2 or 3 minutes. The one other thing I wanted to mention was this 32, how long will you do that for? So you'll do that for, 5 cycles of that, 32, or 2 minutes. And then you will check for the pulse. So Vikas will again feel like how he showed you, he can feel for the pulse in the neck after 2 minutes. Maybe your CPR has worked and the patient has a pulse. If he has a pulse, alhamdulillah, fine. He's got the pulse back. If he hasn't got the pulse, then you continue the whole process again. I hope that was clear. What I will do is, we want to leave the room open for more questions. I know there are a lot of questions from many people. What I will do now is keep this live demo for a hold at the moment. Let's go for the question answer session. And once we take in some questions, we can come back to the live demo and show, some demo to facilitate the answer. Is that all right, Vikas?
Yeah. No. Thank you.
All right.
Thank you, Nabil.
Okay, fine. We'll keep the video on hold for a while. And just turn your video off. We will move to the next thing. We have completed the live demo at the moment. And what we'll do now is we want to go to the question answer session. This will be conducted by Dr. Noordeen. He's one of the emergency physicians along with us. What he's done right now is he's trying to go over briefly all the questions you've asked in the chat room. And you keep your questions coming in. He's having a close eye on it. We will take some questions from him and we'll see what we can do. Nudin, are you there with us?
Assalamu alaikum warahmatullahi wabarakatuh.
Wa alaikum assalam wa rahmatullah.
Thank you, Nabil. Thank you, Nabil, Zishan, and Dr. Vikas for the wonderful slides and demo. So we have got a few questions from the chat room. I've tried to compile them all together because some of the questions were more similar. So if you could answer, I can read out one by one. Yeah.
Sure.
So the first
Before we go that, is
yeah?
Zishan on as well?
Yes, I'm listening.
Okay.
Yeah.
Okay.
And Vikas, is he there as well?
Yeah. And
okay, fine.
Can we do one thing before that? Can we switch to Vikas's video? Can Vikas turn on your video? I'll stop sharing. Great, yeah. And we can go for questions now. Yeah.
Yeah. So the first question is regarding the pulse check. Is it like, do we have to check pulse on the right or the left side, or can we check pulse simultaneously on both sides together?
Zishan, you can answer that.
Good question. So the artery goes on both sides. Can you show Vikas on the neck? So the artery goes on both sides of the neck, carotid, that's a carotid artery, and both of them come, they're very close to the heart. So that's why the pulse can be felt easily. So you can check any side, right side or left side. Can you just go a bit closer with the video and show where exactly it is? Yeah, so you need to check with your 2 fingers. That's the center of your neck, of your throat. And if you go to the side, just like 2 or 3 fingers to the side, you'll be able to feel it on the neck. You can check it anywhere, right side or left side. If you can show it on your neck as well, because yeah. So look, that's the center of his chest, of his throat, sorry. And if you go a bit to the side, to the right side or left side, you'll be able to see. That's where your windpipe is. And that's where you feel for the pulse. And on the left side also, can you show, please? Yes. So no, if you put any of these 2 sides, you can feel the pulse. It's not advisable to check both of them at the same time, but just check once. Okay, just check on one side, maximum 10 seconds. Yeah.
Thank you.
Okay.
That's perfect. Very, very nicely done. The reason we're telling not to check both sides is that the blood supply to the brain goes from both arteries. We don't want to obstruct both arteries together at the same time. Okay, only one artery has to be pressed at one moment. Okay, Nudin, that's great. Shall we move on to the next question?
Yeah, excellent. Thank you. So the second question regarding the use of hand, whether we need to use the dominant hand or the dominant hand at the bottom for chest compressions.
So, I mean, that's easy. I think Vikas can demonstrate that. Since Vikas is a right-handed person, okay, and so he keeps his non-dominant hand down and dominant hand on the top, or either ways, whichever he feels is comfortable. I would prefer to keep the right hand on top of the left, because that's what is comfortable for me. Either ways, whichever hand is stronger for you, you keep that on the top, so that's the hand you're using primarily to push down. Okay, the main thing what Vikas is showing right now is to keep your elbow straight. Your movement comes from the hip, not from your hand. You don't bend your elbow during this point. Your elbow remains straight. As you can see, he's not bending his elbow. His movement is all from the hip. Only his hip is moving. The rest of the body is still. That's very important. Or what happens if you don't do otherwise is your compression won't be sufficient. Is that okay, Nurdin? Do you think anything else to add in that?
Yeah, I think that should be okay. I think the next question is similar to that. The question was about which side we need to give chest compressions and what is the exact location of chest compression. I think that's been explained very well by Dr. Vikas.
Yeah, you can show it again.
Can you show that, Vikas, please? Because I'm seeing a lot of people asking the same question. I think that's very important for them.
Yeah.
So I think you can explain this one, Vikas.
Yeah, Vikas, you can explain.
No, his voice is on mute.
Mute.
Okay.
Okay.
Unmute him. Yeah.
Yep,
Yeah.
we can hear you.
Yeah, can you hear me? Thank
Yes.
you. Yeah. So this is the center of the chest. Okay, and this is a sternum, which is the chest bone, the center, the lower third of the sternum. Okay, for the men, you can calculate the nipple, both nipple, the center of the nipple. For women, it's different. So it's almost similar. So the lower third of the sternum is where we choose, and we should keep our inside of our hand upon the lower third of the sternum, okay, and then put the other hand upon that. Then you start the compression.
Perfect. Yeah.
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 Yeah. Okay.
So what Vikas is summarizing, that just go between the nipples, between the two nipples of the person. You see two, sides. You make the center point, chest bone, lower third. Perfect. Then we move on then.
Okay, yeah, perfect. Thank you. So the next question is about, I'm sure we do have some sessions about AED in the upcoming classes, but the question is about what do we do when we don't have an AED?
Okay. Yes, that's especially in India. It's a good question because in India, most of the places you don't have an AED. See, your heart needs compression to to make it work to come back, and an electric shock is also an important factor in making the heart restart again, like a reset. Unfortunately, if you don't have an AED near you, you need to continue with the chest compression as long as you can. Okay. If the ambulance arrives, you can stop and let them take over. They will have an AED. And I've seen this sadly, some of the basic ambulances in India, even they don't have an AED, the machine for giving the shock. So they just keep on giving the compressions till they reach the hospital. If you have another person, he can come and help you. He can come from the other opposite side and he can do the compression. And you keep on giving the chest compression till the person wakes up again. And actually, I think people can look this up on YouTube, CPR, saving lives, real life. And you will see many people, they actually wake up after 5 minutes because they kept giving compression. So it depends how quickly you're going and, giving the heart like a wake up call. The compression is the first bit. The electric shock is also a better option. If you don't have it, just keep giving it till you can, till a help arrives or till you have energy in your body to do it. Usually a single person can maximum do it alone for 10-20 minutes. Beyond that, if you cannot do it, then you have to stop, sadly. If you have 3-4 people, maybe you can continue for half an hour, 1 hour, but until help arrives, you need to keep doing it. I think I saw a question, what about women? Yes, women can also, you can give the compression on the same spot. And ambulance people also keep giving CPR on route to the hospital. Even you can do it on the way or while moving also in the ambulance. If they have difficulty, they will stop the ambulance.
That summarizes it really well, actually. So the spot for women is the same. I think there are a lot of questions on it. The spot for women is the same. It's between the nipple line, between the nipples. It's the center. Okay. Men, women, there is no difference of where the spot is going to be. It's the same spot. Lower third of the chest bone. Chest bone, the lower third, not on the stomach. That's where your chest bone ends. Just between the nipple, in the center. Between the nipples, in the center. That is where the spot is. Okay. And all on defibrillation, on giving shock, inshallah, next class, we will have a bit more details on it. I have, prepared few sessions to explain what is the science behind it, and we'll go into details, inshallah, next time. I didn't want to confuse a lot about it in today's session. That's why we haven't gone into depth about it. But this is just an introduction, and this is the most important part of the CPR, where you continue giving compressions. Okay, Nurdin, can we continue?
Yeah. So the next question is from one of the sisters, whether can we give CPR on a non-mahram male?
Well, it's about saving lives, isn't it? I mean, saving lives is one of the most important points in Islam. So that's one of the few places where if you read some of the fatwa scholars, they say that yes, you are allowed to do it if you are the only person who knows it. If you're in a room of 10 men and none of them know what to do, and you're the only one who knows how to do it, yes, you can do it, because saving his life is the most important thing. I don't think it should be a problem. And I think the harm of you not doing it because he is a non-mahram or she's a non-mahram is more than that. So do you want, so option is someone dies or someone lives. Someone dies because you didn't touch them, and you didn't touch them because of bad intentions. You just did that because of good intentions. And this is an important point because sadly in a lot of communities which are conservative, this happens, that people look at that in a very odd way. They say that why is this man coming and putting this on the woman? No, they're doing this to save life. Nobody is doing this for fun. This is what people need to understand. They're just doing this for medical reasons. And many places, people have had harm and died because people were confused about this, or they did not want to touch a non-mahram. So it's very important that people know that this is just for saving lives. Yes, you can do this. Another quick thing, sorry, Nabil. Someone asked, how will you know that the person is coming back? You will see them breathing and you will see them moving there and waking up slowly. And another important part is you need to keep checking for response every 2 minutes. That's an important thing. Every 2 minutes, keep checking to know how much. So if you're doing a compression of 100 per minute, if you reach 200 or 240 per minute in 2 minutes, then you need to stop and look for pulse and check for breathing again, and then continue the cycle again. That's one cycle. Next cycle, do the compressions for another 2 minutes, check for response. This is what we do in the hospital as well. That's a good question. You need to keep checking for response every 2 minutes till you see the person breathing or you see him waking up. If no response, continue doing the same thing.
Good. Jazakallah khair for that. And as a thing, I wanted to mention that all of this is a life-saving procedure. And in a life-saving situation, many of you would have learned, who are part of the diploma course, you're learning the maxims of fiqh. I'm sure there are people who are more knowledgeable who can explain that, in a life-saving situation, this is something which takes precedence to save someone's life than to restrain yourself, I think. Allah Ta'ala knows best. We'll move on, Dr. Noordin.
Okay, so we have a few questions about CPR in special circumstances. Like, can we give CPR on a patient who just had a bypass surgery, or who has a pacemaker in place, or who has just sustained a burns injury?
Okay, Dr. Noordin, do you want to explain this yourself? Do you think what is your
Yes.
opinion? Yeah.
Okay, so with regards to bypass surgery, the bypass surgery is basically open surgery. So it takes at least 4 to 6 weeks for them to heal it. But when they lose their pulse and they go in for a cardiac arrest or they collapse without a pulse, our main aim is to bring the pulse back, I think, to make the heart start beating again. So there's no harm in giving chest compression in a patient with a bypass surgery. So when it comes to pacemaker, that means if someone who is on a pacemaker sustains a cardiac arrest or collapse, losing their pulse, that means there is some problem with the heart or with the pacemaker. That means there's no harm in giving chest compressions on them as well. With regards to burns, all you can do is, unless if it's safe, if the place is safe and if there's no signs of danger, you can always put a towel or a cloth on top of the chest and then start giving compressions, because our main aim is to make the start beating again. So it should be okay.
Perfect. Do we have more questions?
And yeah, we do have questions about chest compression. Does it change with age? I think that comes in the upcoming sessions. And there are questions about like when to stop CPR. I think that was explained by Dr. Zishan. Either it's 2 minutes or 5 cycles of CPR. I think that should be okay. So there's a question about what are the symptoms of cardiac arrest.
So we haven't discussed cardiac arrest as such in terms of heart attack and other things. If you see a person collapse, if a person loses his pulse, the heart stops working. We have never seen a person stand up or standing, okay, continues to stand if he's lost his pulse. Everybody collapses. They all fall down at some point. That's because the blood to the brain stops, the person falls down. When a person collapses, holds the chest and falls down or collapses, that is the main sign that he has probably lost his pulse. You have to go and check.
Okay, yeah, that's fine. And another question is how to give chest compressions or CPR if we have two people. Can we give alternative cycles, or do we have to give like 5 cycles altogether and then another person has to take over?
I would prefer that the first cycle, like first 2 minutes, one person should do it. The person who starts the compressions should give compressions. And if you want the other person, they can give the breath, if you want to give the breath. But it's like what Dr. Zishan mentioned, as long as you have the energy, continue doing it. When you feel you're tired, ask the other person to continue.
Okay. Can we stand on the either side and start giving compression, or do we have to be on the same side while giving chest compression, either the right side or the left side of the person who collapses?
I'm sure you can answer that. Yes, it's any of the side, whichever your side you're comfortable.
That's fine. Yeah, I think that's pretty much. And we do have a question. Should there be a skin-to-skin contact for CPR? It just came up. Yeah.
If you can answer that, I think you know.
Yes, yeah. It's not necessary because if someone who has sustained a burns or an injury, and you can always put a towel or something, a cloth or something on top of the chest and start giving chest compression. And it should be okay. But our aim is to push hard and push fast so that the heart starts beating again. And our aim is to send whatever oxygen which is left over in the circulation to the brain. And as long as that's done, it should be okay.
Okay.
And yeah, there's another question. So once we start giving chest compression and the person regains his pulse or her pulse, what do we do next?
Yeah, that's a good question. What happens when you get it back when the person starts breathing again? So there's something called a recovery position. You'll see the images online. So basically, recovery position is putting the person to lie them on the side, like when somebody's going to sleep. Yeah, good one. Yeah, so when someone is sleeping on the right side or the left side, they put their hands. So that's a recovery position. Why we do this is because if any fluid comes from the mouth, it will not go inside and choke the person. It will come out easily and fall if the person vomits or something. So you put all of them in the recovery position. Just roll them on the side and keep them in the side. That is if they're breathing and if you think they're becoming conscious again.
Okay.
Yeah.
Perfect. Yeah.
Thanks,
Vikas,
Dr.
can I
Zishan.
ask something? Yeah.
Yeah, go ahead.
Vikas, can you show how to give breath as well, Vikas? I think so people should do this. It's only if it's a relative who doesn't have any diseases that can come through the mouth, saliva or breathing or whatever. That's what. But for strangers and unknown people, please don't do this. You can continue chest compression. But if it's like, you're someone elderly in your family, this happened, yes, you can give breath. 30 compressions and 2 breaths. You can talk because. So, yeah, until your audio comes back. So basically, head tilt and chin lift. Come close to the mouth. And of course, take out any foreign body if anything is there. Yeah. Take out anything there. And then just, yeah.
Remember to
You don't
pinch
need
the
to
nose.
give breath into the nose.
Yeah.
You can only
Yeah.
give breath to the mouth. Yeah, you can continue, Vikas. Thank you.
Yeah. So like Dr. Zishan mentioned, in this time of COVID, inshallah, I'll be touching on it next. We'll be touching on it next week anyways. But before that, I wanted to mention that in this COVID situation, the new recommendation is that we put a cloth on top of the patient's mouth and face, and we give the chest compressions. I'll be showing this, inshallah, next week. We have all of this coming up. And there were questions about pregnant women having cardiac arrest. We will cover that as well, inshallah, next time. We also will be showing child and a baby, how to do CPR on them. The only main thing I wanted to convey to you, all of you, is that if you're uncomfortable to give breath, you do not have to give breath at all, no need. And if you don't know how to give breath, you do not have to give breaths. All you need to learn and do is chest compressions. If you continue giving chest compressions 100 to 120 per minute, that is the best thing you can do to that person at that moment till the ambulance arrives. So don't worry that if you're not able to give chest compressions, don't worry. Continue just chest compressions. I'll hand over to Dr. Nuddin. What do you think? Is there anything else coming up at the moment?
Yeah, there's a question about breathing. I think I can answer that. So it's about like how long do we give the breaths for?
Yeah.
So it's basically 30:2. The two are the breaths, each breath lasting for 1 second. And make sure you look at the chest and look for signs of chest rise as well when you give a breath. And then resume your chest compressions again. It's 30:2. And yes, I think we have answered most of the questions. There are some questions about pregnant people and babies and toddlers. I think that will be answered in the upcoming sessions.
I just wanted to address that, do not try the CPR on a live person. Okay, it's a very important thing I wanted to answer, because some people might practice. You can practice very well. Practice with a pillow if you want. That will be the safest thing, I would say. Just you can practice whatever you've seen in the video, and we will inshallah share this video in the Google Classroom. You can practice this on a pillow, but not on a real person, please.
Okay.
Yeah, it's dangerous if you can practice on a real person.
And don't worry, if there are more questions coming up after this, we will continue this next week anyways. The next two classes are still going to be on BLS with an extended few topics, which I wanted to show on the screen now. Hold on. You can see here that we have planned for the next session few topics like chain of survival and questions regarding AED, how to do CPR on a child and baby, how to rescue a choking person, and other topics, inshallah. And we are really pleased that many of you have been interactive. You asked a lot of questions. Really glad and happy to show this to us at the moment. And we will continue all of you to participate like this for the next coming weeks. And there is lots more to learn. And I'm sure even one of you, if one of you have an opportunity in the next few days, months, or years to save one life through this, it will be a great ajr for all of us. So Farhan, is it okay? Shall we end the session at the moment? What do you think?
Yes, I think first of all, I would like to thank all the doctors here for the demo and for this lovely presentation. I think the demos were so on point. I think most of us have learned a lot from this one particular class. I think after school, none of us concentrated on this, but yeah, Jazakallah khair to everyone, Dr. Nuruddin, Dr. Zishan, and Dr. Nabil, Dr. Vikas, and I think Dr. Nabil is holding the camera there, who's been doing an excellent job.
Absolutely. Yeah.
Yeah. So Jazakallah
Yeah,
khair.
special thanks to the cameraman as well.
Yeah.
He's done a good job.
Yeah. So Jazakallah khair, everyone. We can take in questions in the Google Classroom, and inshallah, if needed, we can answer them in the class.
Yes.
Yeah.
All right. Jazakallah khair for everyone, and subhanakallah bihamdika ashhadu an la ilaha illa anta astaghfiruka wa atubu ilaik. Assalamu alaikum.
Wa alaikum assalam wa rahmatullahi wa barakatuh.